Hi there, I am Dr. Vivek A.N. I've been practicing orthopedic surgery for the last 15 years. So I'm going to talk a few points about common ligament injuries of the knee. Ligament injuries as a cause of knee pain is very common, especially among the young. These injuries are mainly caused by sporting activities, by road traffic accidents, or sometimes even falls and slips that happen on our day-to-day activities. Now, what are the structures that really end up in causing these knee pains? Yes, let us see. The knee joint is made up of the thigh bone and the leg bone and a lot of other ligaments which provide the stability and the smooth gliding movements. As I said, knee is a complex hinge joint. It just doesn't have one movement, but there are other intricate activities that happen. Now, if you talk about the ligaments, yes, there are ligaments outside the bone which are called as the collateral ligaments, one on either side. There are two ligaments on either side of the knee joint which provide a cushioning effect between the bones. And most importantly, inside the joint are the main stabilizers of the knee joint. One in the front called as the anterior cruciate ligament and one at the back called as the posterior cruciate ligaments. Now, these injuries, any of the injuries that I mentioned, can cause an injury to one or multiple of these structures. Let us talk about meniscal injuries. Menisci, as I said, are like the shock absorbers which are present inside the knee joint. They provide more congruity. They make the surfaces more roundish so that it receives the other part of the bone. These injuries are caused by twisting activities which can be a part of other ligament injuries. If a meniscus is injured, it can hinder the normal activities. It can flip inside the joint and can get stuck when the movement is occurring. When this happens, the symptoms commonly we see are locking, and following that there is severe swelling of the knee joint. Now coming to the collateral ligament injuries, these are caused by again twisting injuries which can be a part of sporting or road traffic accidents. These collateral injuries give rise to pain especially on movements and on stressing the joint. These collateral injuries normally are treated with rest and immobilizations. When we say immobilization, it would probably involve putting a brace on the knee joint. Now, most importantly, when we talk about ligament injuries, the emphasis on the ACL and the PCL cannot be overemphasized. These are the two ligaments which provide the ultimate stability of the knee joint and are the ones which commonly get injured in sporting activities. Now coming to the anterior cruciate ligaments, it prevents the slipping of the thigh bone towards the front on the tibia or the leg bone. Now, when a person has an anterior cruciate ligament injury, it gives instability, especially when he's getting down the stairs, normally walking on uneven surfaces, and sometimes while pivoting activities. Pivoting activities meaning on a fixed leg, if your body is turning to the sides, it is called as a pivoting activity. Now, what are the symptoms of these ligament injuries? Okay, commonly collateral ligament injuries and meniscal ligament injuries cause severe pain on movements and are associated with swelling. When we come to the ACL ligament injuries, the main symptom we look for is instability, especially activities involving running or pivoting activities or using the stairs.